Good afternoon. I want to welcome everyone to today's webinar. My name is Dr. Eric Turing. I'm the Senior Vice President for the American College of Veterinary Preventive Medicine. Today's webinar is sponsored by the American College of Veterinary Preventive Medicine and its partner organizations, the U.S. Animal Health Association, the National Association of State Public Health Veterinarians, the American Association of Food Safety and Public Health Veterinarians, and the National Association of Federal Veterinarians. I would like to introduce our esteemed speakers today. First of all, Dr. Cheryl Shaw is the Director of USDA FSIS Applied Epidemiology Staff in the Office of Public Health Science. She graduated from Washington State University College of Veterinary Medicine and the University of Minnesota School of Public Health. The other speaker we have today is Dr. Andrea Cote, who is an epidemiologist within the Office of Public Health Science and the USDA FSIS liaison to CDC. She also serves as a veterinarian in the U.S. Public Health Service. She's a graduate of the University of Tennessee for both her DVM and MPH. So I welcome our two speakers today, and I will turn the presentation over to the both of you. Thank you.
All right, thank you. Excellent. Thank you so much. Well, good afternoon, everybody. And thank you for joining us for this opportunity to provide an understanding of the mission of the United States Department of Agriculture's Food Safety and Inspection Service, or FSIS, as a regulatory public health agency. I'm Dr. Cheryl Shaw, Director of the Applied Epidemiology Staff in FSIS's Office of Public Health Science. With me today is Dr. Andrea Cote, Epidemiologist Extraordinaire and FSIS Liaison to the Centers for Disease Control and Prevention. Today, we will describe how FSIS uses a One Health approach to advance our public health mission, and we will provide some specific examples that demonstrate the importance of FSIS's involvement in One Health collaborations. Dr. Cote and I will cover the topics shown on the slide, alternating a bit as we go to keep you awake. We do not plan to discuss or answer any questions about the current high-path AI situation today, but we will talk about past situations in which we work closely with our state and federal partners in a One Health manner, and we continue to work with them in current situations. The Food Safety and Inspection Service is responsible for ensuring that meat, poultry, and egg products are safe and that they are properly labeled and packaged. Our vision is that everyone's food is safe. FSIS has 8,700 total personnel, with approximately 7,600 working on the front lines at more than 6,900 federal establishments across the United States and its territories. Over 95% of the slaughter and processing establishments regulated by FSIS are considered small, meaning they have fewer than 500 employees, or very small if they have fewer than 10 employees, or do less than $2.5 million a year in sales. During fiscal year 2023, FSIS in-plant personnel ensured public health requirements were met in meat and poultry establishments that slaughtered or processed 161 million head of livestock, 9.8 billion poultry carcasses, and 2.7 billion pounds of liquid, frozen, and dried egg products. In-plant personnel also conducted 7.7 million food safety procedures to ensure all federally inspected facilities continue to meet food safety and wholesomeness requirements. Our regulatory authority is derived from a series of acts of Congress, namely the Federal Meat Inspection Act, the Poultry Products Inspection Act, the Egg Products Inspection Act, and the Humane Methods of Slaughter Act. FSIS ensures food safety through a series of policies and regulations that define how establishments can operate to produce a safe and wholesome product. Taken together, these form the basis for the actions FSIS takes to prevent foodborne illness. FSIS in-plant personnel conduct daily inspection tasks to verify that regulated establishments comply with the acts and the regulations. Now we'd like to take a look back at some recent events that highlight the need for a One Health approach at FSIS. And I'll start with psittacosis. Don't know if there's any hardcore Jeopardy fans out there, but in December of 2019, an episode featured this question. Psittacosis, aka this bird fever, can also spread to people from ducks and pigeons. So the correct answer is what is parrot fever. So you may notice that they didn't list chickens or turkeys as potential transmission sources to humans. But as shown by events in 2018, these birds should not be discounted when it comes to zoonotic diseases, particularly in occupational settings. So what is psittacosis? It's caused by a bacteria, Chlamydia psittaci, that can infect people exposed to infected birds. However, infected birds do not always show signs of disease or seem sick. Both sick birds and infected birds without signs of illness shed the bacteria in their droppings and respiratory secretions. When the droppings and secretions dry, small dust particles that include the bacteria can get into the air. The most common way to get infected is by breathing in the dust from these dried secretions. Less commonly, birds can infect people through bites and beak-to-mouth contact. This is not a foodborne illness. The symptoms of psittacosis are similar to many other respiratory illnesses. In severe cases, complications may include pneumonia, endocarditis, hepatitis, or inflammation of the nerves of the brain, leading to neurologic problems. With appropriate antibiotic treatment, psittacosis rarely results in death, less than 1 in 100 cases. So how does this fit One Health? Well, there's a human health component, an animal health component, and the environmental component of the dust. So let's talk about what happened in 2018. During August 31 through September 12th of 2018, the Virginia Department of Health and Georgia Department of Public Health were each notified of a cluster of patients hospitalized with symptoms consistent with psittacosis. All worked in one of 2 chicken slaughter plants that shared source farms, one plant in Virginia and one plant in Georgia. Local and state public health officials conducted active case finding to identify illnesses consistent with psittacosis in persons who worked at one of the plants during this time. Workers were classified as having probable or confirmed cases of illness based on case definitions. Probable cases were identified based on symptoms and epidemiologic exposures. Confirmed cases were identified based on detection of C. psittaci. The disease is infrequently reported in poultry plant workers. However, there have been documented outbreaks in the U.S. going back to 1948, when illnesses were identified among workers in a turkey slaughter plant. Another outbreak occurred in 1989 that was also linked to turkeys. In the outbreak that occurred in 2018, occupational exposure to chicken was the risk factor of concern. Working at the 2 chicken facilities became ill with respiratory symptoms consistent with psittacosis. During August through October of 2018, a total of 80 illnesses were reported to public health authorities that were either suspected or confirmed for psittacosis. Of the 80 illnesses, 29 required hospitalization and 43 had pneumonia. 13 cases were laboratory confirmed. So how did FSIS respond? We convened a health hazard evaluation board. This panel of experts rapidly evaluates public health risks of potential human health hazards associated with meat, poultry, or egg products. It assesses food safety risks, worker safety, cleaning and disinfection methods, environmental monitoring, both current and future, and a path to resuming operations. The psittacosis HHEB evaluated potential food safety hazards, requested an in-plant hazard evaluation by NIOSH, the National Institute for Occupational Safety and Health, reviewed ante and postmortem inspection procedures by personnel, developed an incoming flock health screening questionnaire, and assisted with town halls for case finding and prevention efforts. The HHEB identified no significant food safety risk, due to the minimal likelihood of exposure through food. It did recommend cleaning and disinfection measures following environmental testing. FSIS evaluated the epidemic curve of human case patients and the condemn rates for chickens harvested at the facilities prior to illness onset, and then requested and received a full list of suppliers from the establishments. We work closely with our partners in USDA APHIS, the Animal and Plant Health Inspection Service, on traceback, proposals for cleaning and disinfection and environmental sampling, and flock pre-certification statements. We help develop options and criteria for traceback of poultry, questionnaires for potential risk factors, and recommendations for surveillance and prevention. For more information about this outbreak and response, you can actually search the ACVPM YouTube channel for a webinar on psittacosis from September of 2021. Now I will turn it over to Dr. Cote.
Thank you, Dr. Shaw. So in January of 2020, a novel coronavirus was occurring and cases were being identified in China, and there was a potential exposure at a live animal market. CDC began receiving questions about possible foodborne exposures, as well as other federal agencies such as us at FSIS. At this time, a One Health team was created with subject matter experts from both CDC and FDA, as well as us at FSIS. We took the knowledge that we knew about coronaviruses and food safety, and were able to work together to come up with some frequently asked questions pertaining to food. Little did we know that worker safety would come into play and the extent of the novel coronavirus, or better known as COVID-19, and the impact on the food and agricultural sector of the United States. Over the course of the pandemic, we learned more about COVID-19 and the repercussions it had on the food industry. Human cases began to increase drastically, and given the need to feed American people, an executive order was released to keep establishments open, but also to keep the workers safe. This included excluding workers from the facility, testing and increasing space amongst employees. In meat and poultry processing facilities, there was a need to provide culturally appropriate health education materials, screen workers for possible infections, encourage hand hygiene and use of face coverings, increasing the space as mentioned previously, and encourage workers to take sick leave as needed. On top of the need for facilities to continue operations, there was a concern for food security and the protein needed to feed Americans. There was a potential backlog of animals in need of slaughter. Market size animals continued to grow and exceeded size capacity for slaughter equipment. So what could we do with those animals? And then FSIS had existing relationships with federal and state partners to collaborate and address challenges, but we identified better needs to leverage those relationships and to continue advancing those relationships, as well as building collaborations. So during the pandemic, the Assistant Administrator of the Office of Public Health Science at FSIS, who is also our Chief Public Health Veterinarian, identified gaps and needs for FSIS. She reached out to the Applied Epidemiology Staff Director, Dr. Shaw, to come up with ways to assess what had occurred, draft a plan to help identify gaps and needs for the agency, create focus groups, and a better way to collaborate on a more One Health holistic approach. The ultimate goal was, how can FSIS improve our One Health response to better our agency and the activities we do to ensure meat, poultry, and egg products are safe and wholesome? So we'll now discuss the U.S. government and the definition of One Health. So the U.S. government definition of One Health is a collaborative, multi-sectoral, and transdisciplinary approach, working with the goal of achieving optimal health outcomes, recognizing the interconnection between humans, animals, plants, and crops, and their shared environment. So Rudolf Virchow in 1858 had one of the first One Health definitions. Between animal and human medicine, there are no dividing lines, nor should there be. The object is different, but the experience obtained constitutes the basis of all medicine. So what's causing the contamination or issue? Is it animals, humans, or the environment? Is it a mixture of all three? So in our assessment phase, FSIS first had to identify key players in both the animal, human, and environmental health sectors to begin our considerations for One Health. So we looked first at that animal health. We work closely with the Animal and Plant Health Inspection Service, or APHIS, Ag Marketing Service, AMS, Food and Drug Administration, and our state agricultural departments. But we also interact with industry and consumer groups such as retailers and the producing industry groups. In the human health, our primary partners are the Centers for Disease Control, state, local, and tribal health departments. So how can we reach out to those? And for the environment, the Environmental Protection Agency, and then OSHA, Occupational Safety and Health Administration. These were our key players. So now that we had these groups, how do we advance our connections and capitalize on those that we have, but make additional connections to collaborate and establish and embrace One Health at FSIS? Given the information that we had, there had been multiple variations of One Health initiatives, but with COVID-19 and other events arising at the forefront, the 2021 House Appropriations Committee report and the 2023 Consolidated Appropriations Act, Congress directed CDC to collaborate with the Department of Agriculture and the Department of Interior, as well as other federal agencies, to create a national One Health framework to address zoonotic diseases and advance public health preparedness in the United States. The act also directed CDC to collaborate with interagency partners on the development of a One Health coordination mechanism at the federal level to strengthen our One Health collaborations related to prevention, detection, control, and response for zoonotic diseases, and related to One Health work just occurring across the U.S. government. This framework will facilitate One Health collaboration for zoonotic disease prevention and control for the next 5 years. It has a common vision, mission, and goals for key federal partners involved in implementing a One Health approach. So here is just an image of the U.S. government as a whole, and One Health can fall into every department. As you see, the 3 stars highlight the departments that were responsible for the One Health framework, but One Health can be seen in every department and ultimately comes down to the individual. So going through those agencies all the way down to you. The framework team is currently responding to public comments and is not finalized, but will be released when it's completed. Back to you, Dr. Shaw.
All right, thanks, Dr. Cote. So what does our approach and commitment look like? And what have we done to increase our One Health footprint? In 2022, we began by assessing our existing agency activities and responses. Then we developed some functional statements, established our goals and objectives, reviewed our management structure, developed a logic model for implementing One Health, in which we identified the intended results, outcomes, and metrics, and potential unintended consequences, and began implementing the plan. During implementation, we tracked our progress, collected and reviewed qualitative and quantitative progress data, presented a final proposal to leadership, and ultimately incorporated the plan into our AES business process plan. Early on, we conducted focus groups. Focus groups were set up with internal and external state and federal partners. In these groups, we assessed work groups, collaborations, programs, and communication, and then identified gaps and opportunities to strengthen our One Health approach. Participants were identified through formal and informal networks, targeting those working at senior staff, program director, or senior advisor levels. There were 4 to 6 participants per group, and we tried to incorporate a mix of program areas and agencies. Our meetings were hosted on Microsoft Teams, were about 1 hour long, and had 5 or 6 questions each. An optional survey with the same questions was distributed after the focus groups. There were 3 major themes identified from the focus groups. The first involved our approaches and our commitment to One Health. The second, collaboration, and the third, data and information. Regarding theme 1, our approach and commitment to One Health, we recognize that food is central to human health, and the safety of food from animals is directly impacted by the health of the animal and the environment in which it was raised. FSIS has a multidisciplinary staff, which provides us the opportunity to broaden discussions around the impacts of the food system beyond food safety. Even though many of FSIS's daily activities may impact animal or environmental health, we often do not present them or talk about them beyond food safety and mitigating the food-based hazards to human health. As a result, some FSIS employees did not see their work as impacting animal and environmental health. Some focus group participants reported that they did not see FSIS as a visible player in national and international One Health collaborations. FSIS's regulatory authority is very focused, as evidenced by the acts that I showed you earlier. However, there are opportunities to influence the health and well-being of humans, animals, and ecosystems outside of our regulatory processes. Participants readily noted FSIS's role in the National Antimicrobial Resistance Monitoring System, or NARMS. Antimicrobial resistance, or AMR, has fostered collaboration within USDA and HHS at the national and international levels. Participants raised concerns that One Health and FSIS's contributions to One Health had been siloed to just AMR. FSIS policies may be designed to impact food safety, but they also have impacts on food production and distribution systems, sustainability, environmental justice, and the health and well-being of rural communities. Internal and external focus groups participants expressed a desire to see FSIS consider these impacts at the early stages of formulating a new policy or program. Subject matter experts on many of these areas exist within other USDA agencies, and a whole of USDA approach was recommended. This slide shows some of FSIS's current One Health involvement identified by the focus groups, including things like pathogens, diseases, chemicals, workers, and some novel issues. The second theme revolved around collaboration. Some focus group participants, primarily those in FSIS or USDA partners, identified strong existing informal and formal communication channels. Other participants expressed that FSIS collaborates well in specific response-oriented situations, such as foodborne outbreak investigations. However, they recommended building more connections to other program areas within the agency, like our policy and data groups, to support activities related to prevention and data sharing outside the confines of outbreak investigations. Both internal and external participants advocated for a whole of USDA approach to improve communication and coordination and establish a shared definition of how USDA promotes public health. Within FSIS, One Health has been historically viewed as something limited to a very small group within FSIS. Recommendations included One Health communications at all levels of the agency, including in-plant, and participation in the National One Health Framework and One Health Coordination Unit that Dr. Cote mentioned. External participants expressed that FSIS could have a more visible role in national and international collaborations, such as biodefense or security strategies, and even pandemic preparedness. Internal participants stressed the importance of maintaining a presence at scientific meetings and conferences, not just lab, epi, and environmental health, but also local, state, federal partners, and bringing various groups together to allow for new perspectives, connecting our work, and preventing duplication of efforts. The third theme involved data and information sharing. FSIS data that was cited as being the most useful included data related to pathogens, whole genome sequencing, or WGS, and AMR. Internal participants recommended additional opportunities to share data with partner agencies. They recommended publishing timely, relevant communications that help promote our available data, including data that could be useful or actionable to impact human, animal, or environmental health. Some examples of data that could have additional impact include data from inspections, such as dispositions, condemnations, and pathology results, and others including results from cecal samples and occupational health data. Both internal and external participants were interested in finding ways to increase opportunities for data sharing and exploration, including de-identified or aggregate data when appropriate. Specific asks included more information about future work and priorities, and information that supports a One Health approach to addressing food safety concerns, things like pre-harvest information. This slide shows an example of some of the data we share. And speaking of data, we generate a lot. FSIS analyzes around 123,000 samples every year. This generates over 511,000 tests, which then provides FSIS with 2.1 million different data points. The analytes include things like Salmonella, S-Tech, Listeria, Campylobacter, non-pathogenic indicator organisms, metals, residues, pesticides, things like PFAS and other specific compounds. And all of that starts with our annual sampling plan, which is published online. You can see the QR code on the slide. Otherwise, you can just do an internet search for FSIS's annual sampling plan. So what are our next steps? Continue to review, reassess, and move forward. So far, we are embracing One Health within FSIS. One Health is included and specifically named in the FSIS FY24 and FY25 annual plans, which are posted online. FSIS is represented on the National One Health Framework and One Health Coordination Unit, and many other interdepartmental, interagency, and international One Health efforts. We collaborate with other groups throughout USDA, including APHIS and ARS, and other governmental agencies like CDC, FDA, and DHS to discuss topics that could have a One Health impact. Things like high-path AI, psittacosis, climate change, heavy metals, and tick-induced diseases such as alpha-gal syndrome, and more. To increase sharing of data and other information, FSIS posts our isolates and associated data on our webpage. One Health is an integral part of AES's business process plan, and AES generates quarterly internal blogs covering One Health topics to increase awareness within FSIS. How do we decide which topics to focus on? Well, we developed a process to triage our concerns for awareness or response, and I will turn it back over to Dr. Cote.
Thank you. So as Dr. Shaw mentioned, we did come up with a triage process where we assess new, arising, or concerning events that could be related to virus, parasites, different pathogens, natural disasters, really anything and everything that we may need to be aware of. We would use this triage process that we created to assess potential response from the agency. The system would be used for One Health events at FSIS, and we'll discuss more examples later on in the presentation. But a quick just example would be something such as an E. coli outbreak. We identify that there are cases while we're working closely with our federal and state partners, assessing the information provided from the different exposures. And if it appears to be associated with a FSIS regulated product, we would respond accordingly to hopefully identify a given lot and maybe lead to a recall, but ultimately releasing all of the information to everybody out as soon as possible. So first, how do we identify potential issues? Our notification is both active and passive. We hear about potential issues from all sorts, and do we need to be involved? Who's needed? What is the process? Did we get word from our partners, interagency groups, reading the media through a listserv? We've responded recently to some NASPHV listservs. So how are we getting the information and what might be the issue? So in our assessment of the issue, we first have many questions that we look at. Have we had, as Dr. Shaw mentioned, a hazard identification team or health hazard evaluation board review this issue previously? So what is the history of this issue? Is there an immediate impact to food safety or FSIS operations? Do we need to respond rapidly? What is the long-term impact to food safety or FSIS operations? What is the urgency to address this? Is there any sensitivity or PII? How does this align with the USDA FSIS strategic plan? And what is the risk of doing nothing if we weren't to respond? And how does this, or how are other groups working on this in the agency or externally? If so, who? Who has jurisdiction? Are we involved in the jurisdiction? What other entities may be involved? Is it outside of the United States or federal and state partners? And what is the anticipated level of resources required? So we're involved in many aspects in assessing the issue before we get involved. So as mentioned, for every issue that we decide, there are 4 currently responses to potentially take. This means taking no action. So we don't feel that this may be involved in our jurisdiction. Referring to another agency or group, would it best be handled by someone else? Are we going to investigate and coordinate a response or initiate a collaboration or action? Or are we going to monitor and inform? Do we just need to maintain situational awareness of this event? We can potentially move issues throughout these different levels, given the information that arises or may impact FSIS response. And then we could end up responding and investigating. So for some of the responses, we may release information externally, but for all of our responses, we do have internal documentation where we write about every event, the response, and what may have been involved in that event. For certain activities, we have published our after-action reviews for outbreaks. As Dr. Shaw mentioned, data from all of our sampling and data from different activities on the FSIS website. We have also responded to questions regarding FSIS through listservs to internal, external, and potentially international audiences. And we're communicating through these various channels. So whether it be through an email or a teleconference, we are responding as much as we can. So now let's move on into some recent events where we had to respond. So you all might be aware, but on February 3rd, 2023 in East Palestine, Ohio, officials were monitoring the smoldering, tangled wreckage of a train derailment. They urgently warned hundreds of nearby residents who had declined to evacuate, stating that a rail car was at risk of a potential explosion that could launch deadly shrapnel as far as a mile. The information we initially had did not specify what was on the train, but the potential catastrophic concerns of this event and an explosion could impact FSIS. So there was a very large U.S. government response into this train derailment, and USDA did play a role in the response. FSIS maintained situational awareness. We reviewed messaging so we could be prepared in if the situation changed and we needed to respond. In all of this information, no FSIS establishments were identified in the area, but FSIS was prepared to evaluate risk to employees, provide risk communications through program area and routine calls in the agency, answer any questions of concern, as we were concerned for the health of the people in the area. Did we have any employees working in that area or living in that area where they weren't able to get to their facilities if they were to work? What about their health and the health of livestock? Are there any livestock in this given area? Any accumulation of whatever may have come into the environment, livestock, water? What about our future food supply? And any USDA establishments, as mentioned, are we able to operate and can animals and people get into our facilities? So the next example is the mysterious dog illness. So in the Oregon Department of Agriculture received more than 200 cases reported from veterinarians since August of 2023. The investigation of the pathology of this canine infectious respiratory disease complex said that illness is presented with the following symptoms. So mild to moderate tracheobronchitis with a prolonged duration, so 6 to 8 weeks or longer, and it was minimally or not responsive to antibiotics. A chronic pneumonia that is minimally or not responsive to antibiotics, or an acute pneumonia that rapidly becomes severe and often leads to poor outcomes within 24 to 36 hours. So there's a whole lot happening there. So why would we at FSIS care? It's currently not impacting cattle. The department asked FSIS to maintain situational awareness of this. As we understood it, it had only been seen in canines. However, could it move to FSIS amenable species or humans? And would that affect our workforce? We have to stay abreast of these situations and answer questions internally, externally, and from international partners. In February of 2024, AVMA did release press that mentions it appears things have calmed down considerably since the beginning of this year, and it is still an unknown cause of illness. So we at FSIS are committed to One Health. I'll talk about a few things here. So we're working closely with other federal agencies to host a farm to fork meeting. Activities and topics that are new, ongoing, and resolved are discussed in the space amongst government and industry. This meeting covers topics from farm to field investigations, vaccinations, animals, food, and anything in between. We're actually meeting next week for our annual meeting, and we'll discuss topics such as recurrent, emergent, and persistent strains of bacteria that are of concern, and then potential concerns to U.S. food, to just name a few. So there are many additional groups and topics that FSIS could be involved in. Some of these came up during the focus groups. And as you can see, we have potential avenues to discuss antimicrobial resistance, climate change, environmental justice, manure and its impacts, microplastics, particularly in fish, was brought up, mycotoxins in plants and animal feeds, worker safety. These are just a few to name. If there are work groups that we can be involved in, or you think there's something, we would love to hear from you. And then FSIS has recently joined some groups around irradiation. So meeting with CDC and FDA to discuss its use in food and food safety. Alpha-gal syndrome, we're working closely with FDA and CDC, as well as other partners in the consumption of red meat and prevalence of the disease in the US. A climate work group is looking into the impacts on our operations. And that DHHS group around food and agriculture to establish communication and coordination channels to stay abreast of potential issues that may have a larger impact for the US. And then we're working on prevention. Sorry, Dr. Shaw. Prevention, there is a group where we're working internally with other partners in FSIS, as well as with our CDC partners, to try and get information to help prevent potential issues. So there are some challenges for One Health at FSIS. Our primary focus is regulatory authority and enforcement in that food safety space. So One Health could be a bit difficult as it is a collateral duty for those working in the field. But we continue to work closely with all of our partners and those in the agency to expand our outreach and efforts and involvement. But this requires time, knowledge, resources, and we're working on it. And continually monitoring and expanding for work groups past what we currently do. Metrics are also difficult to capture. What do we want to measure and how do we capture it through regulatory and enforcement actions is a challenge. We're working on coming up with some ideas to help if we can capture this. Can we measure a broader public health action? So what benefits are achieved for the greater good and what indirect benefits can we see? These are always difficult and tough question to answer. And we're still thinking through this as an agency. And since this is continuous and an ever-evolving activity for FSIS, we may have some information in the future. And as always, our goal is to ensure meat, poultry, and egg products are safe, wholesome, and properly labeled. I think that's all. Dr. Shaw, do you have any closing remarks?
No, we just, Dr. Cote and I think we love our jobs. Hopefully that came through in the presentation. If you're interested in joining FSIS, we love having more people to come to work with us. Actually, on our website, you can check out at fsis.usda.gov careers/careers and see what we do. So that's it for the presentation. I will stop sharing and we can go to questions.
Can move into some questions. I'm looking here at questions and I'm going to start off with one that talked to or ask a question about the psittacosis situation that was started or that we started with. The question is, were investigations done that would have allowed some assessment of the psittacosis outbreak, or if the psittacosis outbreak was increased or caused by passing the organism between plant workers? For example, considerations for worker location, working next to the person who became ill. This would contrast with consideration for spread due to environmental contaminants or direct from birds in the plants.
All right, I can answer that one. And, just from memory, this was a fairly quick event. And I don't recall any worker-to-worker spread. It was the birds that had come in. And once that was addressed, then the issue is taken care of. The CDC has a really good webpage addressing this also. So as far as human considerations, I'd encourage you to go to the CDC website and look at that further.
Second question is regarding the COVID-19 example. One of the issues raised was animals being too large for slaughter equipment because of COVID-related delays. How widespread was this issue? How was it resolved? Was the event triage process activated?
We didn't have the triage process at that time, and we had developed it later. This was an issue that our Office of Field Operations worked closely with the production facilities, and different facilities have different equipment setups. And so they were able to resolve it in that manner.
Question, not specific for either one of the speakers. Is FSIS working with the EPA? Environmental pollution is impactful to all, ag, animal production, plant production, humans, and pets.
Yes, we do include them, and we touch base on in some different areas, like with even the NARMS, the National Antimicrobial Resistance Monitor, and then Dr. Cote is the liaison to CDC. You may have more contacts.
Yes, as you mentioned, we are working closely with CDC. If an issue arises, they will make us aware. But as Dr. Shaw mentioned, we're I would say probably NARMS in that aspect is our biggest play in contact with EPA.
This one is specifically for Dr. Cote. How might industry get involved in the multi-agency AGS conversation you mentioned during your presentation?
Yeah, this is a great question. So anytime we receive questions or we're discussing topics that are important, we do have, of course, our internal discussions, but try to involving those industry groups and partners as best as we can. So notifying of a potential issue or something that maybe we're seeing with other federal agencies. So we try to schedule those calls as soon as we can to get that information out. If you're aware of something in your industry, if we may not be abreast of that situation, sharing that information that we can have that open two-lane communication to then hopefully prevent a large-scale issue. Dr. Shaw, do you have anything else to add?
I don't. I think you covered it.
I think though too, one just popped into my head in that farm to fork meeting, if there is an issue to bring to that, would be also a great step in speaking with industry and partners and having those smaller discussions too in person.
The next question, first of all, a comment, great presentation from one of our attendees. The attendee asks, can you comment on potential regulatory hurdles that may exist to working in a true One Health collaborative forum?
All right, I can jump on that one. And it does come down to, relationships and connections. And I think that is a lot of the impetus behind the National One Health Framework and the One Health Coordination Unit. CDC is at the center of that. And it really is bringing it's either 23 or 26 agencies, representatives together to have those conversations. So I think we're definitely moving in the right direction and making tremendous progress in breaking down those barriers. We tend to, focus where we work. One Health offers us the opportunity to kind of lift up and look at our partners across in other agencies and have those conversations and see where our paths do cross. So I'm very much encouraged, and that's why we wanted to do that this presentation today, is to show you how we are expanding out in a One Health realm.
We kind of touched on, through the questions, industry, other government relationships. The question here with regard to, more food producers, how do you navigate building trust and protecting interest of the food animal producers while still advancing public health, particularly if there are ever conflicting priorities? And I'm going to say it, I'm considering transparency regarding HPI testing in cows, for example. And I know you're not going to touch on HPAI, but it was part of the question.
Sure. No, I understand that. And this is the meeting that Dr. Cote had mentioned that's happening next week. And we've been doing this. This is our 6th year of this farm to fork. And it is led by USDA APHIS, that they bring together APHIS, FSIS, CDC, FDA, industry representatives, where we can have those conversations about how do we build trust, how do we communicate, how do we share information in a meaningful manner across those entities that you just listed.
And I think we're going to do one final one, and it speaks to communication with state public health departments in states with larger plants, a large number of employees, to share concerns, lessons learned, offer any unique knowledge that FSIS may have regarding plant hazards.
I think I'll let Dr. Cote, you work so much with a lot of the state health departments and all of the outbreaks we do, and AAS has such a robust engagement. Do you mind taking that one?
Sure. I was going to say, we do work closely with state health departments and communicating outbreaks and all of that information. I think for maybe questions about those larger facilities and worker safety might be good. We can connect, and I don't know where the question went, with the district offices that cover those states. Really helpful to engage as there are potential issues that if it comes up, we can connect with you, as well as that program area for FSIS in that area or that state. But always open communication. I've had previous conversations with a state partner. They were made aware of, well, not recently, a while ago, but made aware of a employee that was ill. So they just wanted to let us know. So we work closely with our chief medical officer to share that information if there were to become a larger issue. So we're trying to keep those communication channels open. But if there's a particular question that you have, we'd love to hear from you.
Wonderful. I think that pretty much takes care of the questions that we had today, and we are approaching our hour. But I definitely want to thank our two speakers, Dr. Shaw and Dr. Cote, for taking time out of their busy schedule for today's presentation. Very informative, and you're getting, I don't know if you can see them, a lot of clapping hands coming up from the Zoom screen. So we want to definitely thank you. Two plugs. The first one was in our question and answers. Somebody posted that there is a position available currently, an open notice for a supervisory public health veterinarians open in usajobs.gov. So that's for everybody's information. The second plug is for the ACVPM continuing education program. We can't do this every month without gracious individuals like Dr. Shaw and Dr. Cote volunteering their time to present a topic. So if you're interested in presenting a topic, or if you know someone that would be a great speaker for us, please get in touch with the ACVPM. Once again, you can email me at admin@acvpm.org, or you can go to ACVPM, their website, acvpm.org, and look under continuing education, and you will see all the information about our CE program, how you can volunteer or nominate someone to be a speaker. Our CE committee will evaluate that, get back with folks, because we are always looking to present topics that our diplomats and our members of our partner organizations want to hear. So I want to thank everybody again for attending. Everybody have a wonderful day. And finally, thank you to our speakers.